Welcome to the follow-up after show, kind of our web extra for the viewers that come to the web who watched our big show. And there's a lot more to talk about, and our two guests are still with us. We have Peter Spadafore, the Executive Director of the Michigan Alliance for Student Opportunity, and Dr. Stephen Bigelow, the Superintendent of the Bay City Public Schools. One area we touched on in the live sort of big show a little bit was on mental health. Post-pandemic, that's become a hot issue. More and more people of all ages need the help, particularly in our schools. A year or so ago, Governor Whitmer said, listen, we need to hire 500 mental health professionals, put them in the schools. We're not getting much traction on that. So you see that as a huge issue that needs a lot of work.
Absolutely. Particularly in early grades, including kindergarten, first, second, we're seeing more and more extreme behaviors that require a lot of intervention, a lot of support on behalf of the school staff, and finding professionals that are able to do that is our problem. The funding actually is there. We have a lot of grant dollars that can go towards mental health supports. It's simply finding people within the area that have the certification and are qualified to do that.
And from a statewide issue, that's an issue.
This is huge, yeah. There's an equity concern as well. It's easier, not easy, I'll make sure we're clear on that, to find folks that are willing to go in districts where they can drive quickly to different buildings. But when you start getting farther and farther out state, it's very hard to convince folks to make those trips to provide, even to be able to provide the services needed. We're seeing students coming to the classroom in kindergarten, pre-kindergarten, with a record number of called ACEs, adverse childhood experiences, which create trauma that needs to be dealt with in a professional way. And educators are the ones that we're looking to do that. We don't have the people to do that. They're going into different fields. They're not going into, if they are going into the mental health field, they're not doing it in the school environment. We've been very fortunate to have resources put into this problem. The one resource that isn't there, though, is the human capital, and that's going to be something, you know, we in the big show we talked a lot about the educator shortage. This mental health professional shortage is almost as dire to the school community because we are now being looked to help solve the mental health crisis. It's important that we're talking about mental health, that we're destigmatizing that for our students and letting them know it's okay to talk about it, but we need more professionals to help talk about it in a more artful and professional way.
And it sort of leads to that educator burnout we talked about, because there's a lot more on the plate of our educators. Maybe they're spending less time educating kids if they're dealing with some behavioral issues, right?
Oh yeah, it's difficult classroom management issues where, again, if they're spending all their time just trying to simply settle down a student or the class, they're not able to teach. It harms everybody.
Yeah, and Peter, you mentioned as we were kind of leading up to this segment, like there are some districts in the UP that you're not going to be able to serve that population, right?
Yeah.
In that way.
Districts with the size of Rhode Island, for instance, where they've got a couple buildings, and even just travel time for one individual is not feasible to service a student population. So even if they were fortunate enough to get the mental health professional on staff, that person is going to spend most of their week, you know, the 180 days of the year driving back and forth, and that's just a reality. So when we look at, again, policy solutions and ways to solve this issue, it has to be thought of from an equity perspective as well. How do we make sure the resources are getting where they're needed the most, not just where we can sort of have them? So that's, you know, technology's helping with that. I think, you know, we're seeing a lot of folks rely on telehealth when it comes to mental health, but that's difficult in a classroom setting. You know, classroom management 101,
That's right.
you can't do it over Zoom.
It's not terribly effective in a kindergarten classroom.
Right.
Yeah.
Well, gentlemen, thank you very much. Peter Spadafore, the Michigan Alliance for Student Opportunity, Dr. Stephen Bigelow, right in our own backyard, the Bay City Public Schools. Thanks for coming in, and we appreciate it.
Thanks for
Thank
having
you.
us.
And thank you for joining us for the after show.